Good evening to all. It is very heartwarming to see so many people who have come to listen to my talk on diabetes, and I can see many familiar faces as well. So it's kind of comforting. First of all, thanks to Charles and to you all to giving me an opportunity to talk to you. This is what I like, because when we talk to one per patient, the time is relatively restricted, and in 20 minutes I can reach only one person. Whereas when we talk about such topics, I can talk to 15, 20, 100 people at a time. So we'll start with the session. Most of you know what is diabetes. What is diabetes, by the way? I would like it to be an interactive session. So I'm going to ask questions, and you can also ask questions, of course. So what is diabetes? What do you know about diabetes as of now? Start with this thing. Yeah, tell me.
Sugar in the body.
Sorry?
Excess sugar in the body.
Yeah, so excess sugar in the body is simple definition of diabetes. Lot of people know a lot of things about diabetes, but there are a lot of myths going around. You must have seen a lot of videos on YouTube and WhatsApp and whatnot. So we are going to debunk few of the myths. Before we start, Dr. Gaurang, he is my assistant. I used to practice at Trinity Hospital. That was about 8 years ago. Since then he is with me. So he is a diabetes educator. So we work as a team for diabetes. So before we go into all the details, there is always a disclaimer. What we discuss today, these are general points. Diet, exercise and medicine plan has to be individualized depending on every patient. According to physiological age, then motivation of patient to lead active life, and what other diseases than diabetes the patient has. What is physiological age, by the way? Physiological age. See, I was born in 1977, so my calendar age is 47 years. But what is my physiological age? So I have some 70-year-old, calendar age 70-year-old patients who run 4-5 kilometers. So their age is 50. How old is your body? What the calendar says is a different thing. And I also have 40-50-year-old patient who cannot walk more than 10 minutes. Their physiological age is 80. So physiological age is actually how old is your body, not by calendar. Okay. So what is diabetes and why do we worry so much about diabetes? Next. So why we worry about high sugar is in immediate, there are hardly any complications, but in long term it is a risk factor for heart attacks and paralytic attacks, blindness, kidney failure, cirrhosis of liver, various cancers are more common in diabetic patients, then leg wounds, non-healing ulcers, gangrenes, they are again common, and infertility in younger people, of course. So there are a lot of things that can happen if you don't manage your sugars well in long term. The complications come in after say 15 or 20 years once you develop diabetes. Next. How do we diagnose diabetes? It is simple. It's a blood test. Fasting sugar more than 125 or 2 hour post 75 gram of sugar. It's a specific test. We give 75 gram of glucose and check sugar 2 hours after that. That is about 200. And HbA1c, which is your average sugar of previous 3 months, it is measured in percent. So more than 6.5% is diabetes. So any of these criteria, if they are fulfilled, we call that the patient has diabetes. Next. So what we discussed today are these points. Myths about signs and symptoms, myths about diet, which should be the main focus, myths about medicines and myths about exercise. By the way, I have been given 30-35 minutes. So if I am overshooting and if you are bored, you let me know, we will wind the things up early. Okay. So first myth, no one in my family has diabetes, so I won't get the disease. Now family history is very important. If your mother or father has diabetes, the chances are higher. If both parents have, it is even higher. But it doesn't mean that if parents don't have diabetes, you won't get diabetes. So genetic is only one factor. What are the other factors? Are you doing adequate exercise or no? Are you eating correct food or no? How are your stress levels because of your profession or family issues? Race, ethnicity, that is, and body composition. How much of your body weight is in muscles and how much it is in fat. So all these factors affect whether you are going to get diabetes or you are not going to get diabetes. Next. This is another myth. Diabetes starts only after the age of 45 or 50 years. This was probably true maybe about 20-25 years ago. Now the things have changed. Now type 1 diabetes, this is a diabetes where there is no insulin. We usually detect it before age of 10. So these are all school going children, and the only treatment as of now is insulin. There is no other option. Whereas type 2, it used to be common after 50 years. Now we see this in third decade, 20, 22, 24 years. Even before getting married, people come with high sugars to us. So that's quite common. Next. Another myth. I am thin, I will not get diabetes. So we all know that diabetes is closely related to obesity. Now currently the data that is published for Goa, 26% of the population has diabetes. And that is very closely related to obesity. But being thin doesn't guarantee that there won't be any diabetes. So again, same thing, diabetes is caused by multiple things. Obesity is one of them. Even a person appearing thin can have central obesity. Such people are called thin fat Indians. They look thin, but they are fat internally. Next. And patients other than type 2 diabetes may not be obese, like gestational diabetes or type 1 diabetes, they can be thin. Next. So what do we mean by central obesity? Most of you must have done sonography at certain point of time, and the sonography may mention fatty liver. So so this is how the normal liver looks like, and this is how the fatty liver looks like. If you open abdomen, this is what you are going to see, and this excess fat, the yellow part, is what going to cause diabetes. Next. Again, this is heart, this is healthy heart. You can see a lot of yellow deposits. This is unhealthy fat, or also called as visceral fat. So this is visceral fat that is metabolically active, and it opposes insulin action. That is why the sugar goes up. Next. So how do we detect whether a person is obese or overweight or no? Simple is body mass index. It's a crude method. Even simpler is your height in centimeters minus 100. So my height is 171 centimeters. My weight should be less than 71. Above 71, I go into overweight category. So currently I am at 69. Better waist circumference. It is measured at the level of navel. Should be less than 19 gents, less than 18 ladies. Anything beyond that is called as obesity. So does anyone know what is their waist circumference? Has anybody measured it recently? So today you go home and measure. That will tell you what is the situation. And then body composition, special machines come that tell that how much muscle and fat is there in the body. So this is one body composition report. So normal body mass index is 19 to 25. Simple to remember. But see this patient's BMI is 24, 23.9, which is correct. But still he has a lot of body fat. This should be below 20%. So even if his weight is correct, he has too much of fat, and he is still at risk of developing diabetes. Next. 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 Okay, now next myth. My wounds heal fast, so I don't have diabetes. This is a very common thing. A patient comes with typical symptoms of diabetes. We check sugar. Sugar comes 300. The first thing patient tells us, no, my wounds, last week I had a wound and it healed quickly. So this is what happens later in diabetes. In early phase of diabetes, the wound healing is normal. So they don't heal fast only when diabetes is advanced with complications like neuropathy and peripheral vascular disease. So neuropathy is your nerves are not working normally, and peripheral vascular disease basically means blood supply to your arms and legs is not good. So when that happens, the wounds don't heal, but that needs about 15-20 years to develop. Next. Okay, can it be cured? Obviously, I have written it as, what is that? Oh. I have written it as a myth. So diabetes cannot be cured. Have you heard diabetes reversal, diabetes remission? Have you heard, not heard? So it's true or not true? Yes. So it is true. But then why didn't they call it diabetes cure? Why they call it as remission? Why use a different word? Because that remission is never permanent. Diabetes will come back, maybe after 5 years, 10 years, but it will make a comeback. It is not a permanent cure. Next. So they say that once you develop, see, you know how the sugar is controlled? We need insulin. So once the amount of insulin is less than what you need, then the sugar goes up. By the time diabetes is diagnosed, the capacity of pancreas to produce insulin is already gone by 70%. Only 30% pancreas is remaining. Okay. So once you develop diabetes and then you achieve remission, it is not going to be a permanent thing because only 30% pancreas are now remaining. It is going to come back. So prevention is ideally the key. Next. Another myth. Diabetes means only high sugar. Does diabetes involve anything else other than sugars? See, diagnosis of diabetes is based on sugars, but diabetes affects sugars, proteins and fats, all three. It is not only sugars. So almost invariably, a person who has diabetes will have high cholesterol also. That is because correct insulin action is needed also for cholesterol control. So diabetes means high sugar, high cholesterol and triglyceride. Not only that, there is something called as abnormal protein processing. That's why those who have diabetes find it difficult to maintain muscle mass. Their muscles are smaller because the protein processing is also abnormal. And all are related to either insulin deficiency or defect in insulin action. So insulin is there but it's not working well. So it's not only sugar, it is cholesterol, triglyceride as well as protein. All three are involved. Next. Now a lot of people think that diabetes happens due to absence of insulin. Actually, if you measure insulin level in the early stages of diabetes, you will find that insulin levels are high. But it doesn't work well because of excess fat. So insulin resistance despite having normal or above normal insulin is type 2 diabetes. So diabetes, a person can have a lot of insulin and still can have high sugars. Next. Now what is insulin resistance? Insulin is there but it is unable to work. Can we detect it? This is neck area of a patient. Can you see those small tags? Skin tags. This is a classic sign of insulin resistance. A person comes with skin tags, he may have normal sugar, but this indicates that after few years, his sugar is going to go up. Next. This is another sign, usually seen in obese people. The neck area. The skin is black and thickened. It is called as acanthosis nigricans. This is another sign. When you walk around, look at people, they will have this. Those who have this, they are going to develop diabetes later. Next. So what is borderline diabetes? Anyone? Any other term for this? It is called as pre-diabetes. Okay. So borderline diabetes is also important. It doesn't need medicines. But these people, unless taken care of, they will gradually lead to diabetes within 3 years, 4 years or so. Next. Even pre-diabetic range sugars affect long-term survival. So all the complications that are caused by diabetes are also caused by pre-diabetes. Only the chances are lesser. Okay. And you can delay the onset of frank diabetes by doing something at this stage. So pre-diabetes is very important to detect. Next. So all those were myths about the disease itself, the signs, symptoms. Now we are going to discuss about diabetic diet. Okay, I'll read it for you. I have the mic. 1/4 of what you eat keeps you alive. 3/4 of what you eat keeps your doctor alive. So diet is so important. If you eat wrong food, you are going to get not only diabetes, lot of other things. And this is ancient Egyptian proverb, still holds absolutely true. Next. So we come to biggest myth I was telling further. Biggest myth is, next, there is a diet called diabetic diet. This is the biggest myth. Why this is a myth I will tell you next. People think that they have to cook special food separately for diabetic person in a family. No sugar and all those things. So there is nothing called diabetic diet, but what has happened is what we previously used to call as healthy diet is now called as diabetic diet. So ideally what everyone of us should eat, diabetes or not diabetes, that is diabetic diet. So what we need in diet is, next, a healthy meal that has all macro and micronutrients. What are macronutrients? Macronutrients in food. What are macronutrients? Proteins, fat, carbohydrates. And micronutrients is your vitamins and minerals. So basically we need a good mix of different ingredients or a square meal. And we just need to avoid ready-made food products, refined food like polished rice, maida, sugar, these things. So basically you need to eat healthy, and that is what is diabetic diet. A lot of people tell me I have stopped eating rice because I have diabetes. That is wrong. You did not stop rice. You just have to alter the quantity. Okay, next. Okay, this is another thing. A lot of patients, once they develop diabetes, suddenly they shift to olive oil. Olive oil is good, no doubt. Any idea about olive oil cost? Quite pricey. I think 4 or 5 times our usual oil. So olive oil is good, no doubt. If you can afford, yeah, you use it. But regardless of that, all our cooking oils have certain advantages, certain disadvantages. Okay? Everything including your groundnut oil, your rice bran oil, the safflower oil, mustard oil, all have their advantages. The best option is use them in rotation. So this month olive oil, next oil, groundnut oil, next month rice bran oil. So you get advantages of all oils. Okay? So only olive oil is good is a myth. You can use all oils. Next. Okay, fried food is bad because it will raise cholesterol. Is that true? Not true. Why not true? It raises cholesterol, but it is indirect. As such, any food that comes from plants cannot have cholesterol. Scientifically, plants cannot produce cholesterol. So any oil that comes from plants cannot have cholesterol, including coconut oil. But any oily food, if you are eating too much, it will cause weight gain, and that will raise cholesterol. So oil per se doesn't have cholesterol at all. So if you buy oil and it says zero cholesterol as an advertisement, it is misleading because oils cannot have cholesterol. Okay, but the problem with fried food, it has lot of calories, so it is going to cause weight gain. Lot of ready-made foods have reuse of oil. That reused oil is bad. And what food item you are frying is also important. Okay, for example, French fries, samosa, fried chicken is not that great. Next. So we'll look at some important concepts in diet, because diet is very important. Next. You know what is glycemic index? I have written it here, but basically after we eat some food, the sugar goes up, any kind of food. So how much the sugar will jump is glycemic index, or how quickly it will jump. Okay. So it is relative ranking of carbohydrate in food according to how they affect blood glucose levels. So food that has high glycemic index, the sugar will suddenly shoot up. Something that has low glycemic index, the sugar will gradually go up and come down. So if you choose something with low glycemic index, the sugar spikes will be less. Okay, next. And there is another concept called glycemic load. Now what it means is, suppose you eat 1 teaspoon of sugar and you eat 10 teaspoon of sugar, and you measure your blood sugar levels. After eating 1 teaspoon, the sugar will go up to somewhat level. After eating 10 teaspoon, it will go higher more. Even though you are eating sugar in both episodes, so you are eating more sugar, that's why the sugar goes up. That is load. You are taking extra load. Okay, next. So rice is as good as or as bad as chapati. The quantity matters. As far as diabetes goes, rice and chapati are same. So just because you have developed diabetes, you cannot stop eating rice and shift to chapati or bajri or jowar. All cereals are same as far as diabetes goes. Okay. So this is a chart giving glycemic indices of various common foods. I have highlighted few. See, the white wheat bread glycemic index is 75. Now first, can you see glucose? It is 100, 103. that is highest. Now we compare everything related to glucose. So white rice bread 75, that is quite high. Chapati is 52, not bad. Brown rice is 68, it is much better than wheat bread. Can you see, this is 75 and this is 68. Then cornflakes is a lot of people like to eat cornflakes. Can you see glycemic index, how much it is? 81. 81 is quite high. Compare that with lentils. Lentils is masool, what we call, meaning usur of it, just 32. So lentils are much better food as far as the sugar spike go. Now a lot of people stop eating bananas because they develop diabetes. They think the sugar will go up. See here, banana, glycemic index is 51. So banana is not going to cause sugar spike unless you eat 10 bananas at a time, which is glycemic load going up. Okay. Milk, it has a lot of sugar, but the glycemic index is 39. Okay. What else? I can see ice cream, 51. Now why glycemic index of ice cream is low? Sorry? No. So ice cream has sugar, but it also has fat. It's a mixture. That's why the resultant glycemic index is low. Okay, next. So what does the chart tell us? It tells only about the glycemic index of various food items. It doesn't tell us anything about glycemic load. Only glycemic index. Next. Then it doesn't tell us anything about fat content or protein content or caloric load that the food gives. So just because one food has high glycemic index, it doesn't become bad. Or some food has low glycemic index, like your ice cream, doesn't mean it becomes good. It has its own problems. Next. So glycemic index alone does not decide full nutritional value of food item. That is what you have to bear in mind. Just because it has no sugar doesn't mean the food becomes healthy. And some foods with sugar can be healthy. Next. So nutritional value of food depends on carbohydrates, fat and protein ratio plus vitamins and minerals. Even though banana will have a lot of carbohydrates, it will also have fibers, minerals and vitamins. So banana is good. Next. Okay, this is another thing. Once you develop diabetes, people will suddenly stop eating mangoes, chicus, grapes. Is that needed? No, it is not needed. Next. They also provide vitamins, fibers, minerals. So you have to eat fruits. Next. There are some rules that we follow when you are eating fruit in diabetic patient. Avoid fruit juices. The reason is simple. If you are having say orange, you will have one orange at a time. But if you have orange juice, to make 1 glass of juice, you use 3 or 4 oranges. So automatically the amount of sugar, natural sugar that goes in, goes up. So have whole fruits and always combine fruit with some low glycemic index food. So better to have fruit after a meal, not fruit alone as a snack. That won't cause sugar to shoot up. Next. And decide quantity of fruits depending on sweetness. So if you want to eat mango, you can have one piece, one sheet. Don't have whole mango. You can still have mango. Whereas if you want to have banana, you have whole banana. So how sweet is the fruit is very important. Next. Anybody uses this? What is it? Sugar free. Sugar free. Sugar free, sugar free, natural. Now you add that for sweetness without adding sugar. But ultimately in long term, it can worsen sugar control. It can raise HbA1c and it is related to how it affects your bacteria in the intestine, gut bacteria. So it is not good idea to have artificial sweeteners. Better to stay away. Rather than that, we advise people to have half teaspoon of sugar in tea or coffee. Allowed. That is safer. Next. Okay, you can eat what you want if you are taking diabetic medicines. No. That is another thing. Don't do that. We can control sugar, but you will need much higher dose of medicines. And then you are getting exposed to a lot of side effects. So this is not a good idea. Another thing, people come to know that carbohydrate cause sugar to rise. So they suddenly try to stop eating carbohydrates. Practically that is not possible because our main source of energy is carbohydrates. We cannot suddenly stop eating carbohydrates. Okay, it is essential fuel, you have to have. Okay, what is the solution? You reduce the quantity of carbohydrate and consume something called as complex carbohydrate. All of you eat chapati or pav? Some one of those. So what is the weight of one pav or one chapati on an average? Around 50 grams. I have measured it. Around 50 grams it comes. Out of those 50 grams, 30 grams is sugar. Not added, natural. And it is in form of something called as complex carbohydrate. Simple sugar, your table sugar is a simple sugar. As soon as you eat, it goes into blood. The sugar in your chapati, pav or rice, it has to be broken down by intestine into smaller units and then it is absorbed. So it doesn't cause sudden spike in sugar. So complex carbohydrates. Next, you cannot stop carbs. So how to control glycemic index and glycemic load? Once you are diabetic, you need to control these things. So there are some very simple steps that you can follow. First is portion control, how much you eat. So instead of eating two chapatis or 2 pav, you reduce it to 1.5 or 1. And how to eat less, use a smaller plate. Immediately works mentally. It's very simple. Secondly, when we eat dal rice, what we usually do, we take that rice in a plate and add dal. It is liquid, so it flows. So we don't add much of dal. Instead, you choose a bowl. You take less rice, you can add a lot of dal. It's not going to flow out. So by changing the proportion of dal and rice, you are eating more of proteins and less of carbs. So that way you reduce your glycemic index. Next. Then mix high glycemic index food with low glycemic index food. Next. Keep a gap of 10 to 15 minutes between 2 servings. Most of the people, not all, most of the people take 2 servings of food. So if we keep a gap of 10 to 15 minutes, usually after first serving, after 10 minutes, we realize that our stomach is already full. We automatically eat less. Our usual problem is we eat more than what we need. That's a usual problem. So this is how we solve. Just keep a gap of 10 minutes. And you have to have high satiety foods. Just because cholesterol is high, if you suddenly take off all the fats in food, you don't get satiety. You will feel full, but within half an hour, 1 hour, you'll again feel hungry. So your food has to have some protein as well as fat in your food. Otherwise, you don't get that satiety for long. So you have a food that has some protein and fat. Next. Okay. Now, in past, I didn't include this topic in the discussion, but then people started asking me about this because a lot of people take alcohol daily at night, 1 peg, half peg. What did you take? So, back. So does alcohol raise sugar? Anybody has experience, actual experience? The actual experience is if you have alcohol at night, the next day morning sugar drops, doesn't go up. There is a reason for it, we will discuss. You wanted to say something? No? Okay. Now we cannot calculate glycemic index of alcohol. Why is that? To calculate glycemic index of any food, it has to have some carbohydrate. Alcohol is a different chemical altogether, ethanol. Okay, so we cannot calculate. You call it 0. So it's not going to cause sugar to rise suddenly, but it contains a lot of calories, but no other nutrients. So when you eat excess calories, it is always converted into fat for storage. And any excess fat, as I have shown you pictures of liver and heart, it is going to go and collect there. And ultimately it is going to cause sugar to go up. Okay. So alcohol immediately won't cause rise in sugar. But in long term it is going to affect. Next. Next. Sagansa kar next. So heavy amounts of alcohol show direct diabetogenic effect. So long term heavy amount, the sugar will go up. Excess calorie intake is going to result in obesity and sugar will go up. It is going to damage your pancreas where insulin is produced. So again the insulin production will go down, sugar goes up. It is going to disturb carb metabolism and glucose metabolism, and obviously it affects liver function. Everybody knows that. That also indirectly affects the sugar level. Next. If you consume alcohol in the evening, it causes hypoglycemia next morning. So if you are going to take alcohol at night, always have some food with it. Or if you are going to take only alcohol, don't take your diabetic medicine. Otherwise next day the sugar will drop. That's a risky thing. And why it happens is alcohol at night reduces growth hormone production, and growth hormone is necessary for maintaining sugar in addition to insulin, glucagon and other things. So immediate effect, drop in sugar, long term effect, diabetes. Next. So this is just for fun. How do 280 calories look like? Here are food items and these are activities. So 280 calories is 2 pegs of whiskey or 1 samosa. So somebody is having 2 pegs of whiskey, he is having 1 samosa every day, something like that. 1 cup of upma or 2.5 roti or 100 gram of gajar halwa or 2 gulab jamuns or choco chip ice cream, 120 cc, 2 scoops. So if you have 2 pegs of whiskey, how you can burn those calories? You have to do 30 minutes of cycling or running or 40 minutes of swimming or 1 hour walk at 5 km per hour, 20 minutes of skipping. Can anybody do that? Skipping? Difficult. I can do for 10 minutes, even I cannot do for 20 minutes. Football, 1 hour of house cleaning or 40 minutes of tennis. Huh? That's good. So somebody has 1 extra peg of whiskey at night, he needs to compensate by extra 15-20 minutes of running or cycling. That is how we look at it. Okay, next. So those were myths about diet. Any doubts? We'll proceed to medicines. Now I'm not going to pick up individual medicine, but myths about medicines in general. Next. This is a big myth. When patients get admitted for something temporarily and we have to start insulin, the patient tells me, I don't want insulin, because they think once on insulin, always on insulin. That's not true for everyone. This is true only for type 1 diabetes. There is no other option. Or diabetes has passed more than 15 years and now the tablets are not working. That is when we add insulin. Patient is usually on insulin long term or during pregnancy. That is the safest medicine. Most of the other patients will need insulin on temporary basis. After a few days, they will shift back to tablets. So people need not worry about insulin. Next. This is another myth. They don't want insulin, 2 things. One, they think it's an injection, so injection is always a taboo. They don't want injection. Second, they think that insulin will cause sugar to drop. But every diabetic medicine can cause sugar to go low. So if you are worried about insulin causing sugar drop and that's why you are sticking to tablets, tablet have equal or even higher chances of causing sugar drop. Okay? It is a common side effect of all diabetic medicines. No, it is not side effect actually. Their job is to reduce sugar, correct? So if they are doing their job in more efficient way causes the sugar drop. So it's not side effect, actual effect. Now other than sugar drop, there are a lot of other side effects of various tablets. Insulin has the least number of side effects amongst all. 2 main side effects. One is sugar going low, which happens with any medicine. Second is weight gain. Other than that, insulin hardly has any side effects. Next. This is another thing. They don't want insulin because they think they will get addicted to this thing. Or this happens even with hypertension patient. We tell the BP is 150/90, we need to start medicine. Patient says, no, I will get addicted to medicine. Now what is an addiction? Can you define addiction? So you get physically or mentally dependent, but we call it as addiction when you are consuming a substance that you don't need. Now you need medicines to get free from disease or complication. That cannot be called addiction. You may become dependent on medicine, but you don't get addicted. So calling it as addiction is a wrong thing. I mean, I have patients who don't take insulin because they are scared of getting addicted, but they smoke 15-20 cigarettes every day. So it's a contradiction. Okay, next. Okay, this is another problem. Controlling sugar prevents all complications. This is another myth. Now, chances of developing eye injury, retinopathy, the kidney problem or nerve damage can be reduced to a large extent by sugar control, but we cannot eliminate it. How we look at it is, suppose you develop diabetes at age of 40, you don't control it, you are going to get neuropathy at age of 60. But if you control it well, you will probably get neuropathy at age of 80. So you get another extra 20 years of life without complications. Okay. And for prevention of heart attacks, paralytic attacks or gangrenes, controlling BP and cholesterol is equally important. Only sugar control is not going to prevent these complications. These complications can be prevented by controlling sugar alone. But for overall health, you need to control the other two factors also. Next. Okay, sometimes the sugar is well controlled, we stop insulin. Doctor has stopped insulin, it means diabetes is under control, I can be relaxed. No, that is never the case. Once you have developed diabetes, you have to be strict about your diet lifelong. Strict means at least 25 days in a month. 5 days you can enjoy. 25 days you have to be strict. Okay? Diabetes is a progressive disease. At certain stage, the sugars are going to go up. So you have to monitor. So medicines may stop, monitoring never stops, lifelong. And that is true for non-diabetics also. I don't have diabetes today, but I still check my sugar once in 6 months because I may get diabetes after a few years. So monitoring never stops, even though you stop insulin. Next. I stopped my medication because my sugar readings were normal. This is another problem. The moment the sugar comes under control without asking patient stop medicine. Don't do that. The sugars are normal because you are taking medicine. When you stop, the sugar doesn't go up. We do reduce medicines, but it is a stepwise process. If it is sugar is lower normal, we don't stop something suddenly. Next. Diabetic medicines will damage my kidneys. This is another common misconception, common myth. None of the diabetic medicines that are being used currently cause kidney damage. They have a lot of other side effects, but they do not cause kidney damage. But as the diabetes progresses, the kidneys gradually stop functioning. It's a slow process, but it happens. Once that happens, once the creatinine value goes beyond certain things, then we have to reduce the doses of medicines because they can accumulate. The kidneys normally throw out the medicines. When kidneys are not working well, the medicines accumulate, cause other side effects. But medicines per se do not cause kidney damage, the diabetic medicines. Next. No need to check blood sugars frequently while taking medicines. I will get symptoms if it is high. I don't have symptoms, I need not check. This is another common thing. You always check the patient depending on the situation, check it daily, weekly, monthly, something. But sometimes patients don't check. Next. So symptoms, they come only when the sugar goes very high, like above 300, or comes very low, like below 70. But sugar which is 200 will not cause symptoms, but it will still damage the organs. You still have to control it, check it. Next. So what is the treatment of diabetes? Yes, but this is only partially true. The main thing is diet and exercise. This is secondary. Okay, exercise and diet are as important as your medication. Do not neglect those also. You just cannot neglect. Next. Okay, I like cycling, so once in a while I put some snaps. This is taken near Talegaon Panchayat. Next. Okay, so that was about general the diabetes, medicines. Now we are coming to exercise. Before we go into this, how many of you do exercise? Raise your hands. Okay. How many of you do something beyond walking? That's very good. Huh?
Walking also an exercise.
So what exercise you do?
I do a lot of exercise.
Okay, that's good. So we'll look into the exercise part. And this is a lot of times neglected in elderly people. We'll see. So what are the aspects of exercise? So one is strength, which involves weight training or resistance bands or body weight exercise, push-ups, pull-ups. But there is something called as strength training. This is needed to build your muscles or at least maintain your muscles. See, naturally once we pass age of 40, we start losing the muscle mass, natural process. But muscles are very, very important for maintaining sugar, one. Second, preventing falls. Falls is a major issue in elderly. So preventing falls, and if your muscle mass is good, even after falls, the chances of fractures are less. We get a lot of elderly people with femur fracture, and that proves to be last disease of that person. They rarely come out of it. That's a big problem. So to prevent that, you need to maintain muscle mass, and that is called as strength training. Next. Then comes endurance. So strength in simple words, how heavy can you lift? And endurance is how long you can do the exercise. So brisk walk, jogging, cycling, swimming, racket sport, football, different types of endurance exercises. So most of the people will focus on walk. They rarely do this part, but they still do. Next, the other two aspects are almost completely ignored. These are next, flexibility. And last I hardly see anyone doing this is balance work. Most of the times people will think exercise, yes, I walk and it stops there. That's a wrong thing to do, regardless of your age, regardless of the age. Okay. Now you have to train balance. You have to train. For example, are you able to lift your leg and can you untie your shoe? You have to try that. So once your balance is trained, your balance needs training. Once it is trained, even if you trip, you're walking and something comes, you trip, you will not fall. You will automatically adjust the balance. So you are reducing chances of fall. So you can use various poses in yoga, or there is something called as balance board. Multiple things are there, but you have to train your balance. So remember, strength, endurance, flexibility and balance. All are important. Don't focus only on one. All are important. Next. Okay, we'll look at some myths. Next. Exercise ensures weight loss. No. You have to be equally vigilant about your diet. If you do a lot of exercise, but you eat even more than that, you will gain weight. So it's all about your caloric balance. Okay. So exercise alone, just patient tells me that I am walking but I cannot lose weight. There is something wrong in the diet. Next. Walking is the best exercise. This is another big myth. You have to do something beyond. If you cannot do anything else, then yes, walking. But walking is the easiest exercise. You have to do something beyond that. Next. This is more of a problem in ladies. They feel that they will become bulky like bodybuilders if they start lifting weights. That doesn't happen. The bodybuilders that you see on TV, they are lifting weights, but they are taking steroids and they are eating a lot of calories in excess to gain muscles. So if you are eating correctly, you are not going to get bulky. You will just lose fat and maintain muscle mass. Okay. So don't worry about looking bulky. My daughter comes to me with me to my gym. She knows that this is not going to happen. Next. A lot of people think that their bones will be strong, they won't get fracture if they take calcium and vitamin D. No. For that calcium and vitamin D to work, you have to do something called as impact exercise. Walking is one light impact exercise. Jogging is better. Weight training is better. So you have to take calcium, vitamin D, and you have to work your muscles in specific way to make bones strong. So exercise is important. Next. There is another myth. People with diabetes shouldn't play sports. Big misconception. Next. They can and they must play sports. It is not only physical, it is mental also. It helps mental strength. Patient with diabetic neuropathy should be careful. Some patients have diabetes which is advanced. They cannot feel the ground properly. If they get wounds, if they get calluses, they don't feel it. They should be careful. They have to use proper footwear. But those who don't have neuropathy or have mild neuropathy should definitely go into sports. Next. Don't do exercise on empty stomach. There is a chance that the sugar will drop. So don't do exercise on empty stomach. Always carry some sweet in your pocket. Suppose by chance you feel low sugar while doing exercise, you have that. Okay, next. And we follow something called as FIT principle for exercise. FIT is nothing but frequency, intensity, time and type. Okay. What should be your frequency? At least 5 days a week of exercise. Intensity, moderate. Do you know intensity, how to measure intensity of exercise? It is very simple. If you can easily talk while doing exercise, it is mild intensity. Okay. Now you can talk with some difficulty, it is called moderate. And while exercising, you cannot talk at all because you are breathless, that is high intensity. So we are looking at only moderate intensity, not low or not high. High intensity is used by athletes. We don't need that. We are common people. Moderate intensity is good enough. Time 30 minutes per day. Good enough. If you want to do 15 in the morning, 15 in the evening, also good enough. But stick to at least 30 minutes a day. That's not much to ask, I think. But 30 minutes out of 24 hours you have done exercise. What you do in remaining 23 and a half hours is equally important. It is called as sitting is a new smoking. Because if you are sitting for a prolonged time, it has some health effects, bad effects that are as bad as smoking. So this is mainly applicable to IT people who are sitting in front of computer for hours together. So what you do in remaining 23 and a half hours, maybe 8 hours you sleep, you still have about 17 or 16 hours to do something. You have to be active. You cannot say that I have done exercise 30 minutes, that's more than enough, now I'm not going to do and sit and watch TV. And type of exercise, 3 days of cardio. You're walking, whatever you like, swimming, cycling, stationary cycling, but include 2 days of strength training, which is weight training. This is regardless of age. If you can walk, you should lift weights. There will be some patients, like a patient who has cardiac failure with very poor heart pumping. Normal pumping is 60. This person has less than 30%. Then he cannot lift weights. Or somebody who has a severe spine disease, he cannot bend. Then that is out of question. Or bad joints, then it becomes difficult. But other than that, regardless of age, you should lift weights. You should lift weights. That's going to help a lot. So I think all of you are mobile because you have come to this place. That means you can walk and you should lift weights. Need not go to gym. You can have a kettlebell at home. You do some exercises or you use your body weight. But lift weights. Okay, next. Do you know these people? Who is this? Yes, Arthur Ashe. That? He's Pakistani bowler. Is Wasim Akram. Now their photos are here because both of them had type 1 diabetes. So they were on insulin for years together. But they have achieved great heights in their respective sports. If they can do, then every diabetic person can do it. Okay, next. Now this is a team of cyclists. The name is Novo Nordisk. Novo Nordisk is a big company that produces insulin. If you have heard Novorapid, Actrapid, this insulin, if you have heard, you know Novo Nordisk. This is their cycling team. And they participate in international races. The races are anywhere between 150 to 250 kilometers in a day. So that takes about 5 to 7 hours to finish. All these people have type 1 diabetes. All. That is a criteria to get entry into their team. You have to have type 1 diabetes and they compete at international level with other regular teams. They are on insulin pumps. So it's a hectic sport. I cannot ride more than 100 kilometers in one go. But they ride 150 to 250 kilometers at 40 kilometers per hour like a motorcycle. So it is not easy, but it is not difficult also. It is somewhere in between for diabetics to do exercise or play sports. Okay. So that was all about exercise part. Next. Yeah, so thanks for listening to my nonsense. If you have any doubts, I suppose you will have a lot of doubts, you can ask.